Hello viewers, good morning. The topic that we are going to look at today that is mushroom diseases. When mushrooms are growing in the cultivation site, it can be affected by many microbial diseases. The diseases of mushrooms are mainly caused by bacteria, virus and fungi. In this video, you can see in the detail about the disease spread by bacteria. The second bacterial disease, mummy disease. The name meaning mummy, it is fully reflect the symptoms of mummy disease. That means all the water molecules can comes out and the mushroom become very dry and too dry and leathery appearance. That is the mummified form of mushrooms. It is the major symptoms of mummy disease. The mummy disease caused by Pseudomonas fluorescens bacteria. This mummy disease first found out by the US scientists C.M. Tucker and J.B. Reutin in the year 1942. And the affected mushroom base is bulging and it has fibrous mycelia around it. And the mushroom strips that can come out and stretch out from the axis and curves slightly. And the tilted small caps become very tightened and open too early. These mushroom tissues is it too harden and the mushroom appearance become very dry and leathery. And this is mummy disease infected mushrooms. It's very dry form of mushroom. The mummy disease affected mushrooms, it's never rotten. The color of affected mushroom is grayish brown in color. When the mushrooms are harvested, when we break that mushroom, when we break that infected mushroom, it makes some creak sound. And when we pulled out the mushroom from the casing soil during the harvesting period, the base of mushroom have comes out with a big amount of mycelium. And this is the symptoms of mummy disease. The fruiting body have tilted cap and early veil breaking and the base of strip that has enlarged. The tissues of mushroom become too dry and leathery and grey in color. The infected mushroom is very tough and dry texture when we touch, and it gives some gritty texture when we cut that mushroom. And the mummy disease spread by different factors through contaminated water splash and introducing unpurified form of air to the cultivation site and usage of improper sterilization or improper pasteurized compost and gassing soil and using of old straw and maintain the too much of humidity level. And the mummy disease spread quickly 10 to 13 centimeter within 24 hours in all direction of cultivation site and spread by overly humid compost and gassing layer especially at high air humidity. And due to the fact that the mummy disease spread by spores of Pseudomonas fluorescens and the growth of mushroom can slow down that growth and stop the total growth of mushrooms. And grayish shade of mushroom that is highly indicate it is infected by mummy disease and it is a bad quality mushrooms. And how to control and prevent the mummy disease. We can identify the mushrooms are affected by mummy disease due to their appearance and dried form of that mushroom. For this purpose, so when we identified, so it is affected by mummy disease, we make a groove in the infected mushroom bottom from the bed that is 50 meter away from the infected or diseased area. We made a groove and it has 20 centimeter wide and remove all the compost and casing layer from that groove and we are going to sprinkle 0.5% formalin solution or Strozen salt and then water. After it, the area is fully covered with polythene film and leave it for some time. If the mushrooms are cultivated in the container like bags and blocks, the affected containers are totally removed. And end of the cultivation cycle, the temperature should be increasing up to 70 degrees Celsius for an hour. So all the wooden surface have to be disinfected and maintain the proper sanitation methods and maintain the full hygiene of mushroom farms, then we can control the mummy disease. Thank you.